What if I told you that the reason you drift when you walk, that quiet pull to one side, that moment of hesitation before your body decides which way is straight, has nothing to do with your legs at all? And what if I told you that the real cause is something happening inside your neck right now that nobody has ever explained to you? Because here is what I see happen over and over again. Someone starts drifting when they walk. They reach for walls when they stand up. Their body hesitates in ways it never used to. They go to their doctor and they hear the same things every time. Watch your step. Hold the railing. Maybe it's just age. So they go home, try a few leg exercises, and nothing changes. The drifting continues, the hesitation continues, and eventually they accept it as inevitable. I am here today to tell you it is not inevitable. I am going to explain exactly what is happening inside your body in plain, simple terms, and then I am going to walk you through 8 exercises that target the real problem directly. No gym, no equipment, just a wall, a chair, and less than 12 minutes a day. If you are over 70 and you have noticed yourself drifting when you walk, type drifting in the comments right now. And tell me how long this has been happening. I want to see who is ready to fix this. Before we get into the exercises, let me ask you something. Do you reach for walls when you stand up? Do you feel like you are being pulled to one side when you walk? Have you had a close call or a fall in the past year? Do you feel uncertain on your feet, especially when turning? Have you been told that this is just part of aging? If you answered yes to any of these, you are not broken. Your brain's balance command center is just running at reduced capacity, and the fix is simpler than you think. Type yes if this sounds familiar. Here is what most people do not understand about walking after 70. The cerebellum is your brain's balance command center. It is a small structure at the base of your skull, sitting right above where your neck meets your head. Every second you are upright, it receives signals from your muscles, your joints, your inner ear, and your eyes. It uses all of that information to make constant tiny corrections that keep you walking straight. When the cerebellum is working well, you never feel it. You just walk. When it starts running at reduced capacity, you drift. You grab walls. Every step feels slightly uncertain. A 2021 study found that cerebellar atrophy is directly linked to gait and cognitive performance in elderly fallers. Another study from 2024 confirmed that with the aging of the cerebellum, there is a decline in balance and motor function, particularly fine motor skills, and an increased risk of falling. Smaller cerebellar volume has been associated with slower gait and poorer balance, independent of other brain abnormalities. But here is the part that most people never hear. The reason your cerebellum is not getting what it needs is often not in your brain at all. It is in your neck. The arteries that carry blood to your cerebellum travel through the bones of your neck, one vertebra at a time. These are called the vertebral arteries. When your neck muscles become chronically tight from years of posture habits, old injuries, or simply the way you hold your head while reading or watching television, they quietly compress those arteries and reduce the blood supply reaching your cerebellum. Not dramatically, but enough over months and years to slowly erode your balance and coordination. A study on motion-related vascular abnormalities at the craniocervical junction documented cases where mechanical compression of the vertebral artery led to reduced blood flow. Research has also shown a decrease in blood flow and velocity in the contralateral vertebral artery with head rotation. When your neck is tight and restricted, that blood flow is compromised. Cervical proprioception, which is your neck's ability to sense its position in space, significantly contributes to balance in older adults. A study found that cervical spine movement control declines with aging in asymptomatic populations. Another study showed that elderly individuals with chronic neck pain had impaired cervical proprioception and functional balance. And here is the critical insight. Stimulating cervical afferent input, the sensory signals coming from your neck, can increase postural instability in older people with chronic neck pain. Your neck is not just holding your head up. It is telling your brain where your head is in space. When that signal is compromised, your balance suffers. So fixing this means addressing both sides, releasing the restriction in your neck and retraining the cerebellum directly. That is exactly what these 8 exercises do. Now let me show you the exercises. We work in 2 groups today. Group 1 releases the neck tension. Group 2 trains your cerebellum. You need both. They work together. Group 1 Neck Release Exercises. Exercise 1 Base of Neck Rotation Release. The junction where your neck meets your upper back is one of the two areas most likely to accumulate stiffness that compresses the arteries feeding your cerebellum. This movement gently mobilizes that exact zone. Here is how to do it. Sit in a sturdy chair with your back straight. Gently drop your chin slightly toward your chest. Place 2 fingertips against the bony bump at the very base of your neck, that prominent vertebra where the neck meets the upper back. Slowly rotate your head to the right, using your fingertips to apply gentle guiding pressure in the same direction. Move only as far as comfortable. You want a mild stretching sensation, never pain. Hold at that gentle endpoint for 3 to 4 seconds. Slowly return to center. Repeat on the left side. Do 5 repetitions on each side. Practice once in the morning and once in the evening. Most people notice their range of motion gradually increasing over the first 1 to 2 weeks as the stiffness begins to ease. Exercise 2. Side neck stretch. The large diagonal muscle running from behind your ear down to your collarbone is one of the most chronically overworked muscles in the body. When it stays tight, it places sustained pressure on the structures running through your cervical spine, including the arteries feeding your cerebellum. Here is how to do it. Place one hand flat against your collarbone on one side and press gently downward to anchor the tissue. Slowly tilt your head toward the opposite shoulder and lift your chin very slightly upward. You should feel a clear, deep stretch running along the full side of your neck. Hold for 20 to 30 seconds, breathing slowly and steadily. Do not pull or force. Let gravity and time do the work. Return slowly to center and repeat on the other side. Do 2 repetitions on each side per session. Exercise 3. Neck self-massage. Stretching releases muscle length. Massage releases the deeper tissue tension that builds up over years and does not respond to stretching alone. The kind that quietly narrows the space around those cervical arteries. Here is how to do it. Using the fingertips of both hands, begin at the base of your skull and apply firm circular pressure as you work slowly down both sides of your neck toward the base. Spend about 60 to 90 seconds on each side. Look for areas that feel noticeably tighter or more tender than the surrounding tissue. Spend a little extra time on those spots, not digging in painfully, but applying steady, gentle pressure until you feel the tissue begin to soften. Do this once daily, ideally in the morning. Group 2 Cerebellum Training Exercises. Exercise 4. Slow motion straight line walk. Before you can retrain your walking pattern, you need to slow it down enough that your brain can consciously register and correct each step. Slow motion walking strips away the momentum that normally covers up your weaknesses and forces every muscle and every balance signal to work with full intention. Here is how to do it. Find a clear hallway. Place one hand lightly on the wall if you need support to start. Begin walking at the slowest pace you can manage. So slow that each step takes a full 3 to 4 seconds to complete. Lift your foot deliberately, pause briefly in the air, reach your heel slightly forward and lower it to the floor with full control. Feel your weight shift through your foot before taking the next step. Walk 10 steps forward. Turn carefully using small marching steps. Walk 10 steps back. That is 1 set. Complete 3 sets. What to focus on? Look straight ahead, not down at your feet. Your balance system needs to work while your eyes are focused on where you are going, not where your feet are landing. The wobbling you feel during this exercise is your cerebellum actively working. That is not a problem. That is the entire point. Exercise 5. Tandem heel-to-toe walk. This directly simulates the kind of walking that causes the most falls. Narrow hallways, stepping carefully around furniture, navigating tight spaces. It trains dynamic balance, which is your balance while you are actually in motion, not standing still. Here is how to do it. Stand at one end of a clear hallway, with one hand lightly touching the wall. Place your right foot directly in front of your left, so that the heel of your right foot nearly touches the toes of your left. Then step your left foot forward in the same way, heel to toe in a perfectly straight line. Take 10 steps forward, turn carefully. Take 10 steps back, that is 1 set. Complete 2 sets. Keep your eyes forward, not down at your feet. Walk slowly and with full control. If you need to touch the wall for a moment, that is completely fine. Touch it and continue. Consistency matters far more than perfection here. Exercise 6. Standing marches with cross-body tap. This rebuilds 2 things at once. the hip flexor strength needed to lift your feet clearly off the ground with each step, and the cross-body coordination that is one of the cerebellum's most important jobs. Cross-body movement activates the neural pathways between the two hemispheres of the brain, which is essential for smooth, coordinated walking. Here is how to do it. Stand tall behind a sturdy chair with both hands lightly resting on the back. Lift your right knee toward your chest as high as you comfortably can. As your knee rises, tap it with your left hand. Lower the right leg with control, then lift your left knee and tap it with your right hand. That is 1 repetition. Do 10 repetitions on each side, 20 total. Move slowly and deliberately. The tapping hand and the rising knee should meet at exactly the same moment. That precise timing is what trains the cerebellum. Exercise 7. Fixed point turn, dizziness, and disorientation during turning movements. Pivoting in the kitchen, turning to look behind you, getting up and changing direction, is one of the most common triggers for falls after 70. This exercise trains exactly that skill by forcing your visual system and your vestibular system to coordinate during rotation, which is precisely the job the cerebellum struggles with when its blood supply is compromised. Here is how to do it. Stand facing a wall with a sturdy chair or countertop nearby. Choose a fixed point at roughly eye level, a light switch, a picture frame, any clear mark on the wall. Lock your gaze on that point. Now take 3 slow steps and execute a complete 360-degree turn. During the turn, keep your eyes locked on that fixed point for as long as physically possible. The moment the turn is complete, find that same point again immediately. Do 5 full turns per session. Start very slowly. As this becomes easier over the following weeks, gradually increase the speed of the turn. Do not close your eyes during this one. The entire benefit comes from the active coordination between what your eyes see and what your inner ear feels during the rotation. Exercise 8. Multi-direction weight shifts. Most falls do not happen going straight forward. They happen when you reach sideways, turn slightly, or shift your weight in an unexpected direction. This exercise trains your ability to move your center of gravity in multiple directions and recover back to center, which is the core skill your body needs to catch itself before a stumble becomes a fall. Here is how to do it. Stand behind a sturdy chair with both hands resting lightly on the back. Feet hip-width apart, back straight. Slowly shift your weight to your right foot, lifting your left foot just 1 inch off the floor. Hold for 3 seconds. Return to center. Now shift to your left foot, lifting the right foot just 1 inch. Hold for 3 seconds. Return to center. Now shift your weight gently forward onto the balls of your feet, just far enough to feel the challenge without your heels leaving the floor. Hold 3 seconds. Return. Then shift gently backward onto your heels. Hold 3 seconds. Return. That full sequence, right, left, forward, back, is 1 complete round. Do 3 rounds. Now let me tell you about the 5 most common mistakes people make with balance exercises. Mistake number 1. Doing exercises in socks on a hard floor. Socks on smooth surfaces are slippery. A slip during a balance exercise can cause a fall. Always go barefoot or wear non-slip shoes. Barefoot is actually ideal for balance training because it maximizes the sensory feedback your brain gets from the ground. Mistake number 2. Looking down at your feet. Your balance system needs your eyes to look where you are going. When you look down, you confuse your brain. Look straight ahead. Trust your feet. Mistake number 3. Rushing the movement. Speed is not your friend. Fast movements use momentum instead of muscle control. Slow down. Each movement should take 2 to 3 seconds. Control is everything. Mistake number 4. Holding your breath. When you concentrate, it is natural to hold your breath. But holding your breath increases tension and reduces oxygen to your muscles. Breathe normally. Exhale as you move. Inhale as you return. Mistake number 5. Doing all the exercises at once, then quitting for the week. Consistency is more important than intensity. It is better to do 5 minutes of neck release every day than to do the full routine once a week. Start small. Be consistent. A study found that frequency of intervention use correlated significantly with improvement in balance. Now let me answer the 5 most common questions people ask about balance and walking after 70. Question 1. How long until I see results? Most people notice less drifting within 2 weeks, significant improvement in balance within 4 to 6 weeks, full integration of the new walking pattern within 8 to 12 weeks. Be patient. Your cerebellum took years to decline. It will take weeks to rebuild. Question 2. What if I have already fallen? Start with the neck release exercises only. Use a safety corner. Keep a chair nearby. Go very slowly. If you have had a recent fall that caused injury, talk to your doctor before starting any exercise program. Question 3. Can I do these exercises if I use a walker or cane? Yes. Keep your walker or cane nearby. Use it for support. The goal is to maintain the function you have and gradually improve. You do not need to do the exercises without your mobility aid. Question 4. How many times per day should I practice? The neck release exercises can be done twice daily. The cerebellum training exercises can be done once per day. Spread them throughout the day. Even 30 seconds here and there adds up. Question 5. What if I feel dizzy during the fixed point turn? Stop immediately. Sit down. Rest. If dizziness persists, talk to your doctor. Some people have inner ear or blood pressure issues that affect balance. Get clearance before continuing. Now let me give you a practical 10-step protocol to stop drifting and walk straight again. Step 1. Set your schedule. Morning is best for neck release. Afternoon for balance training. Step 2. Find a clear space. Hallway for walking exercises. Open area for turns and weight shifts. Step 3. Go barefoot or wear non-slip shoes, never in socks. Step 4. Neck rotation release. 5 reps each side. Morning and evening. Step 5. Side neck stretch, 20 to 30 seconds each side, morning and evening. Step 6. Neck self-massage, 60 to 90 seconds each side, once daily. Step 7. Slow motion walk, 10 steps forward, 10 steps back, 3 sets. Step 8. Tandem walk, 10 steps forward, 10 steps back, 2 sets. Step 9. Standing marches with cross-body tap, 10 reps each side. Step 10. Fixed point turn, 5 turns, multi-direction weight shifts, 3 rounds. Let me quickly recap the 8 exercises, the 5 mistakes, the 5 questions, and the 10 steps. The 8 exercises: base of neck rotation release, side neck stretch, neck self-massage, slow motion straight line walk, tandem heel-to-toe walk, standing marches with cross-body tap, fixed point turn, multi-direction weight shifts. The 5 mistakes: socks on hard floor, looking down, rushing, holding breath, inconsistent practice. The 5 questions: timeline, wicks, recent falls, start slow, walker lane, use them, frequency daily, dizziness, stop and rest. The 10 steps: set schedule, find space, go barefoot, neck rotation, side stretch, self-massage, slow walk, tandem walk, marches, turns and shifts. Here is the truth that most doctors will not tell you. The drifting, the wobbling, the reaching for walls, none of that has to be the final chapter. Your cerebellum has not given up. It may simply need better input, better blood flow, and better daily practice. When you give your brain the right challenge consistently, it can respond, slowly, quietly, and steadily. The people who improve the most are not always the ones who push the hardest. They are the ones who show up every day, even when nothing seems to be changing, because the brain often improves before you can feel it. New pathways are being trained, old signals are being reawakened, and then one morning you walk across the kitchen and realize something important. You did not reach for the wall, you simply walked. Start small today. Do the neck release. Try the slow motion walk. That is enough for day 1. Then add one more exercise every few days. Your goal is not perfection. Your goal is to teach your body, one careful repetition at a time, how to trust the ground again. Give yourself 6 weeks of steady practice, and you may begin to feel more control, more confidence, and more trust in your own steps again. If this video changed how you see balance after 70, hit like so. Winds of thought can bring you more science of the body you inhabit. And comment below. Do you drift when you walk? Type drifting or walking straight and tell me how long this has been happening. Your balance has been waiting for the right fix. Start today. Send this video to someone who needs to hear it. Your parent who grabs the counter when they stand. Your friend who avoids walking outside. Your spouse who feels nervous turning in the hallway. Their balance is not broken. Their cerebellum just needs the right input. You do not need complicated balance gadgets. You do not need expensive therapy. You need neck releases, slow walks, and consistency. Start today. Your straight walk is waiting.